Welcome to Talk Law Radio with attorney Todd Marquardt of the Marquardt Law Firm at marquardtlawfirm.com.
Welcome back to Talk Law Radio. I'm Todd Marquardt here on 9:30 a.m. The Answer, and we're talking with Marya Eddaifi. Is that right? I got it. Good. And she's in obstetrics, labor and delivery nurse, and she was telling us how she got to that point, and then we'll talk about some of the special talent and training that she has that helps other ladies have natural births. And we'll talk about a hidden legal issue blind spot for pregnant women and when if something happens where they end up on life support. But for now, we're going to go back to learning about how Marya was called to this profession. So you were mentioning that you joined the military because it offered a better way of life for you. So continue helping us understand where your calling came from.
And so because I was already an EMT, emergency medical technician, when I joined the Air Force, I had my National Registry license. So they kept me in that job. And I ended up working at Wilford Hall, which at the time was the Air Force's Level 1 Trauma Center in San Antonio.
Mm-hmm.
Actually was stationed in San Antonio for 10 years. I worked as an EMT in the emergency room, and then the latter half I worked out at Camp Bullis with security forces and their training squadron. And I thought I was going to go into emergency medicine as a nurse because that seemed to be natural. I loved emergency medicine. And while I was in nursing school over at the University of Texas Health Science Center, San Antonio, I did a women's health clinical, which happened to be in labor and delivery. And I had no interest in women's health whatsoever. And I had kind of realized how hard I worked in the emergency room. And with the postpartum and the labor care, it was over at Methodist that I did my clinicals. I saw like this different side of things. You weren't rushed. It was just a slower pace, and you really were getting to talk to people and know people. And I thought, maybe I don't want to do emergency medicine. And I talked to a lot of nurses that were in labor and delivery to ask how they felt about it, because it was a very hard decision for me to make. I'd been in emergency medicine since 1998. And here we are in 2008, 2009. And I thought, if I don't really like it, it would give me good experience to get better with newborns, and I could move into the neonatal intensive care unit, NICU nurse, and still get this critical care, because I really love critical care. And so that's was my plan, actually, to do labor and delivery, to get better with newborns so I can move into a NICU specialty. So that's what started it. Absolutely no interest in it in the beginning. But when I finished nursing school, and I went to Lake and Heath, which is in England. That was my very first duty station as an OB nurse. And we went, they have special training for OB nurses called perinatal nurse course. So when I went back to do the perinatal nurse course, I hadn't done any labors with patients yet, but I had spent time with the postpartum patients while I was waiting for my school slot to open up. And something was happening to me. These women were postpartum, and I could see some had such joy and happiness with their birth experience. And then I could see some that, they didn't have such a good experience, and maybe they ended up having a very difficult delivery. Maybe they ended up in a C-section, which they didn't plan for. And I could really feel that, because I was having a lot of flashbacks of my own birth. And I started to really feel protection towards women because I was taking them postpartum. I started to really feel like I don't want them to have the experience I had. I was brought back 15 years to the past. My son was 15 years when I became a labor and delivery nurse, 15 years
Okay.
old. And what happened in my birth was I was just a 22-year-old young mother. We were stationed in Hawaii because my ex was in the military, Navy. And so we were stationed there. And I was alone. It was my first pregnancy. I didn't have a lot of friends. I was a dependent wife. And I went in for a doctor's appointment at around 40 weeks. And I honestly don't even remember because that's how little I knew of pregnancy and birth. And
Mm-hmm.
let's remember 1995. We didn't have internet. We didn't have social media for me to get
Right.
information. So my 100% trust was in the doctors and nurses who were going to take care of me.
Right.
And I went to the doctors. It was an appointment. I was getting an ultrasound. They were going to do like a amniotic fluid test to see how much fluid I had. And at that time, I didn't even understand what they were doing. I just showed up for my
Yeah.
appointment. And they did a scan. And the technician who was doing the ultrasound said, your fluid's kind of low. I think you probably will go have your baby today. And I didn't understand that because I didn't understand there was such thing as induction. I'd never heard of it. I don't know about it. And I thought he was kidding. And he walked me up to the labor and delivery unit. I was by myself. And let's remind people, no cell phones. Okay. So I get to the floor and they start admitting me. And I didn't understand what was happening. And I said, like, well, can I call my husband? And they were like, sure. But he was at work.
Mm-hmm.
And and I was trying to call his office and there was no answer. And I kept trying. And finally I got a hold of him. And so he shows up. And next thing I know, like I have an IV, I have monitors on me. Nobody's explained anything to me. Nobody's taught me what these monitors are. Nobody's explained why I have to keep some stupid thing on my finger.
Mm-hmm.
And so I'm oblivious to everything. And while I was there, they started the induction and it didn't go well. And I remember if I was trying to use the bathroom, I would hit the call bell, nobody would come. So I would just take the monitors off and go to the bathroom. And then everybody would run in and kind of scold me for being off the monitor, going to the
Right.
bathroom. You can't do that. And I'm like, I don't understand. So then I back in bed, nobody encourages you to get out of bed. Nobody encourages you to do comfort measures or anything like that. So I crawl back in bed and they didn't do something called ripening my cervix. I didn't know if I needed to have a ripened cervix. I only know these words now as a labor nurse,
Mm-hmm.
but they didn't do any ripening of my cervix, which is very, very important step. They just went right to Pitocin. And I believe I might have been 40 weeks, but I didn't count my pregnancy in weeks. I counted it in months because that's how like little I knew about
Yeah,
pregnancy.
that's what I always thought too, with
Yeah.
that
I didn't
pregnancy
understand
would last 9 months.
and I didn't understand why people cared about weeks.
Right.
Now I understand. But I said, this hurts. And I didn't know what to do for pain. I didn't understand epidurals. My mother and my sister, they both experienced natural labors and births, but we didn't talk about it. So I wasn't like talking to my sister and her saying, you need to do this or that. No, like we just didn't talk about birth at
Mm-hmm.
all. So I don't know my options. Nobody's giving me options and nobody's saying anything to my husband at the time of what he could do for me to help me. Instead, he sat in a chair just lost. And I'm crawling around the bed and I'm getting uncomfortable and I'm hitting the call bell and I'm like in pain and I heard and they're like, well, how about we give you IV pain medication? I said, okay. So that was okay for a couple of hours. And then it started hurting again. And then I called them and I said, well, what else can you do? They said, well, you can't get an epidural yet. And I didn't even know if I wanted an epidural. I didn't know anything about epidurals. I had heard from a friend that they could paralyze me. So I was like, yeah.
Right.
So I'm so like in the dark about everything. And they said I could get one when I was 5 centimeters. So I literally was crawling all over the bed. Finally, it's 5 centimeters. And finally, they say I can have an epidural. So I get an epidural. And then next thing I know, they say, okay, we're gonna come and break your water. Again, I don't know what that means, but I say, okay, that's what they're gonna do. So they break my water. And then I remember just them coming in again, flipping me to the left, flipping me to the right. And they're like, it's not working. It's not working. We're going to have to go back for a cesarean. And here, sign this consent. It basically says that you're consenting for a cesarean. You have, a chance maybe you might not have kids because there could be like a hemorrhage and a hysterectomy, or I don't remember everything. And I thought, should I sign this? Like, they just told me I might not be able to have kids after this. Like, that's all I heard.
Wow.
It would have been a better explanation, but that's all I heard.
Mm-hmm.
And I said, well, I guess I don't have a choice. So I just signed it. And then I went back for a section. And we had a camcorder, a Sony Handycam, if anybody remembers, but
yeah.
So I have a recording of that in the OR. I have no pictures or recordings of us in the birth room. But when they had me on the table and my arms were strapped to the arm boards, and we don't do that anymore. We don't strap arms to the arm boards there. They shouldn't. But they brought my son to me and I couldn't even look at him. And you can see that in the recording. Like, they're like, look, and I just was turned, okay. Like, I just was in shock. And then they brought my son out to some nursery. I never saw him. And then my recovery was done in the post anesthesia care unit, where I was alone because my husband was with the baby. And I had the labor shakes, which nobody explained to me what those were. So I was just shivering, and I'm by myself. Just not even other patients. It was the middle of the night. It was 2:30 in the morning. I was nobody coming around to talk to me and soothe me, completely alone. And then we go back to the recovery room. And at the time, it was a long weekend. It was Labor Day weekend. So there's nothing for me to do. Like, there's just some basic cable. There's no Netflix or anything.
Right.
I'm left like just by myself and trying to breastfeed this baby that, my family didn't breastfeed. I don't know what made me want to breastfeed, but I was like, oh, I just feel like breastfeeding. So I'm breastfeeding and I don't really know what I'm doing. But I remember just feeling really by myself because I didn't have any family there. We were in Hawaii and my family's in Canada. And so I went home and I was just felt confused. I didn't know how to tell people I had a baby because I did not consider myself giving birth. I was like, I didn't really birth a baby because I didn't have a normal birth. Like, right. I'd never known anybody who had a cesarean. That's like how little I knew.
We're going to have to take another break. And we're going to take a couple of minutes this time. And when we come back, we'll talk about the hidden legal issue blind spot of what happens if you're pregnant and on life support. So stay tuned.
This has been Talk Law Radio with attorney Todd Marquardt, brought to you by the Marquardt Law Firm. You can learn more at marquardtlawfirm.com. And be sure to listen to the full Talk Law Radio show Saturday mornings at 11 on 9:30 a.m. The Answer.
Each week, attorney Todd Marquardt talks about the law. His mission with the Talk Law radio show and podcast is to help you discover your legal issue blind spots. In the beginning, God had one law. Don't eat from the fruit of that tree. Then came the 10 Commandments. Now we have federal, state, and municipal lawmakers that won't stop creating new laws. Laws that might impact you without you knowing it. Listen to the show and drop a line on Facebook or email host@talklawradio.com and let the host know what you think of the show, the topics you want to hear, and whether you want to be a guest.